welcome everybody. Really excited for you to join this second session of our training series. And 2 hours is a long time, but we're hoping to have a nice mixture of presentation that's a little bit of theory, a little bit of practice, drawing on some concrete examples, and lots of time for interaction and participation with you all as well to start to get to know each other and share experiences. So with that, welcome to this second session of our Causal Pathways Initiative training series. This is looking specifically at values-driven rigor and quality. And the two trainers today are myself and Flora. We'll introduce ourselves in a second and just wanted to acknowledge some of the other folks that took part in the content development here. Actually, yeah, so there's just a bunch of names there, but we'll get the slides to you later as well. If we go to the next slide, then just give you a little bit of background on the Causal Pathways Initiative, which you've made it so far here, so you probably know a little bit about it. At least you're on a listserv or a network or something. But ultimately, it's an international network of evaluators, methodologists, philanthropic leaders, and other. And the network really is focused on supporting philanthropy and other funders and their evaluation partners to build awareness, build will, and build skills on the use of evaluation approaches that can help us make sense of causal relationships that don't depend on more traditional experimental and quasi-experimental approaches. So the little tagline that the network has is making visible the black box of philanthropic and systems change strategies, helping us collectively see how systems are or aren't changing. So we're really excited to have you here with us today. Just a brief introduction to the two trainers on the next slide. My name's Drew. I'm a principal researcher at an organization called Mathematica based in Cambridge, Massachusetts. And I've been involved in systems change and systems change evaluation for a number of years now, thinking about how we can use systems change frames to both design interventions or strategies and to evaluate them. And I've been part of the Causal Pathways Initiative for a couple of years now and really looking forward to being here today and co-training with my good friend and superstar Flora, and I'll pass it to her to say hello quickly.
Thank you, Drew. Hey, everyone. Great to see you all. I'm connecting from Florianopolis in Brazil, where I live. I've been working on monitoring, evaluation, and learning of philanthropy and development interventions for more than 2 decades at this point. I'm a political scientist by training, and yeah, we'll talk more about my work and my experience as I give examples today of the work. So let's pass it back to Drew.
Sounds good. Thanks, Flora. And now we just wanted to take a minute to get to know you all as well. So we're going to put up a wee poll that you'll see here. Just 3 questions: your organization type, your role within that organization, and your level of experience with causal pathways. And ultimately, we're putting up these questions for a number of different reasons. The first poll about organization is a recognition that when we're thinking about causal pathways evaluation, it's not just for evaluators, but it takes a network, a wider ecosystem. So we're keen to see who's showing up to these types of trainings. Um, when we're thinking about role, recognizing that causal pathways evaluation, particularly when we're thinking about systems change, isn't just the voices of evaluators, but it's about inclusion and participation from multiple different perspectives. So keen to see the different folks that are interested in learning a little bit more about this. And causal pathways evaluation is a journey. I've been doing it for a number of years, and the more that I get into it, the more I realize how much more I need to know. So just keen to see where people see themselves on the causal pathways evaluation journey as well. So looking at the first poll, looks like we've got a good mix of some nonprofit, for-profit sector, a little foundation, and a healthy number of others. So that's coming from lots of different perspectives. That's great. About half of us are a little more, almost 2/3 are evaluators, and we have some people at different levels, which is quite interesting. Can you all see the poll? Is the poll showing for everybody? Yeah, it is. Okay, thank you, Bruna. Oh, Cecilia, it's not for you. You don't see it. Hmm.
Don't worry, I trust you.
Okay. I'll just read it out then quickly.
Great.
Yeah, and then in terms of level of experience, looks like we have a healthy um, mixture of people. About a third are new to a causal pathways evaluation. Almost 40% are saying they've learned about it but haven't conducted one. A little under a quarter have little experience, and just a few have conducted it. So that's really good to know. Thank you all for sharing that. And I think without further ado, we're going to start to dive into the content. So we'll go to the next slide. Uh, and just talk about what we're here to explore in today's training. So our focus really is on building knowledge of how to use a values-driven approach to strengthen the quality and rigor of a causal pathways evaluation. So for those who weren't able to attend the first of this three-part series, you might find this training doesn't really get into what a causal pathways evaluation really is or causal pathways work. That was part of the first session. And if you're looking for more information for that, feel free to let us know and we can help you there. And the next session, which you might be interested in attending part three, is going into a little bit more of a deep dive on focus on the step-by-steps of designing a causal pathways evaluation. But we thought that we would do a second one in the middle of those two around rigor and quality to just start to align on these key concepts as we think about what that means for causal pathways evaluation design. So what we're going to talk about today is a little bit about rigor and unpacking this concept and notion of rigor and rethinking what rigor looks like for causal pathways evaluation. Two different ways that we can strengthen rigor within these evaluations by our evaluator practices and by surfacing our values within these evaluations. And then we're going to talk about some different ways that we can operationalize those practices in terms of inclusive and participatory approaches and evaluations, causal pathways evaluations, and the use of rubrics as one way. And then we'll have some time for question and answers. So I've got the learning objectives up here and just a quick flag that we're constantly trying to improve these trainings. So if you have any feedback, please let us know. It's a relatively large group, so we're not going to be able to pause for Q&A throughout, but please feel free to use the chat. 2025, we're all very active chatters. So drop your questions in the chat. We'll collect those. We also have some time at the end of the training to ask questions, and we'll try to get through as many as we can. If not, we've been in a practice of developing some sort of frequently asked questions documents after these trainings as well, which will circulate. And you'll get these materials. So you'll get the slides at the end of the session, which means that you don't have to take notes on what you see from the slides, but screenshot it, whatever, if that's helpful to you. Okay, with all of that preamble, let's start getting into what we're talking about here and rethinking rigor. This training is trying to dive as much as we can into in 2 hours, thinking about how we can define rigor and ensure quality in a causal pathways evaluation. And it's a really important conversation because, we all hear the word rigor a lot bandied about in evaluation. If we go to the next slide, Floor, just starting to share a little bit of that wider framing. Typically, when people talk about rigor in an evaluation, is that a rigorous evaluation, or did that method or was that approach rigorous? It's often equating rigor with particular methodological approaches. Rigor is a methodological concern, which leads to some hierarchies in thinking about rigor, that some evaluation methods and hence designs are more rigorous than others. And if people have seen these hierarchies, there's a notion that maybe experimental or quasi-experimental designs are more rigorous than non-experimental or more observational designs evaluations. And hence the methods that are used or privileged in those types of designs are more rigorous than other types of methods that aren't. But when we start to back out what's underpinning some of these methods are some assumptions about what we value in a type of experimental design evaluation, specifically, for instance, things around control, stability, fidelity, or replicability. When we're thinking about manipulating an intervention to generate difference-making evidence about whether an outcome occurred or didn't occur, well, then we value our ability to control the intervention. the stability of implementation, fidelity to implementation, and our ability to generalize or replicate those. Those are what we value, and that's how we judge rigor. But when we think about a causal pathways evaluation, for anybody who's involved in systems change and done systems change evaluation, systems are dynamic, they're multi-actor, they involve evolving and adapting relationships, and they're highly context specific and sensitive. So when we're thinking about what a quality evaluation looks like in systems change, we're not as concerned about some of the values that some of these other methodologies hold around control, stability, fidelity, replicability. In fact, those types of concerns would be too rigid, linear, or even context blind for a causal pathways evaluation. So when we want to think about what rigor and quality look like in a causal pathways evaluation, we have to think about some of the dimensions that we would value from a systems change effort. That an evaluation that is quality of a systems change effort has to reflect a broader set of dimensions, such as centering or honoring complexity, or inclusion, given what we know about systems change and multiple different perspectives. Inclusion would be something we might value within these evaluations, and understanding and attuning to the emergence nature of complex systems. Emergent and plural causal pathways could be other things that we would underpin as dimensions of what we might look for in a quality causal pathways evaluation. So ultimately, when we're thinking about judging the quality and rigor of a causal pathways evaluation, we aren't focusing on a particular methodology and what the rigorous application of that methodology looks like, but we're taking a step back to reflect on what we value in a causal pathways evaluation and using that as our guide to thinking about what rigor and quality look like. Now, on the next slide, we talk a little bit about some of the work that this training and our approach is built on. And really, it's about thinking about values and what we value in a causal pathways evaluation. A lot of us here in this room are evaluators. Evaluation is at the core. Values are at the core of evaluation. It's about making value judgments. I mean, the trick is in the name. Evaluation is to give value to something. And values are really making a comeback in evaluation. If anybody's read some of the recent work from Emily Gates and Tom Schwant about values and valuing and research and evaluation, people are starting to think more and more about how do we unpack our values and what our values in evaluation mean for defining or redefining rigor. So today's training is really based on a core guidance that is really informed by a large collaborative effort around understanding rigor called the Inclusive Rigor Framework. And some members of the Causal Pathways Initiative are also part of the Inclusive Rigor Framework. They've been doing a lot of thinking and thinking about how do we surface values and what do those mean for judging quality within a Causal Pathways evaluation. Within the Causal Pathways Initiative, we've developed a rigor guidance informed by and guided by the Inclusive Rigor Framework to help recognize what a high quality, rigorous causal pathways evaluation looks like. So there's some links to some resources here where you can read more, and we're going to start to get into what that looks like a little bit more now. But ultimately, what we're trying to get at within this training is thinking a little bit more about how we define our values and our practices to strengthen rigor. So on the next slide, we provide a little bit of a framework that's going to help to guide the training and our discussions today. Um, Ultimately, as we mentioned, values really are at the core of our work, and they inform our areas of curiosity, the questions we ask, the methods and approaches we use, how we approach sense making, the data sources that we think are important or that we deem that we value within an evaluation. And if we can start to surface all those values early on, then we can start having some conversations about what it would look like if that value was centered and present at every stage of an evaluation. It also has an important aspect around how we as evaluators show up. The perspectives that we bring to an evaluation and the practices that we bring as well. So as evaluators, it's not just about us determining value, but if we value inclusivity and participation, then the way that we surface other people's voices and experiences is an important characteristic as well. So let's just say that if I was concerned about the replicability of a particular intervention, well, what that would determine how I focus the evaluation, the questions I ask, and the methods that I use. And that's the conventional way that we've often thought about rigor within evaluations. But let's just say that within a causal pathways evaluation, a particular systems change initiative, I value equity and centering equity within the evaluation. Well, then that changes how I'd be focusing that evaluation. It might lead to different types of questions. It will certainly lead to different types of methods and approaches that I'd use in understanding how equity is being centered, who participates in sense making, the types of data sources, maybe not just quantitative data sources, but more lived experience data coming in, and who participates in all of these processes. If I can surface that value, then I can start thinking about how that shows up at every stage of the evaluation and taking a step back to understand my perspective as the evaluator in that process as well. So we're going to dig into this a little bit more, and I'm going to pass it now to Floor to dive into some of the details.
Thank you, Drew. So we're going to start looking into greater detail and giving you more examples about practices and values, as Drew mentioned. I think the part of the magic word today is like critical thinking and analysis that we make about what we do, but also how we interpret, analyze, and move from sort of like the information that we gather and how we go about gathering that information. So to talk about practices today, we're going to focus on two particular ones that have been underscored by the Causal Pathways Initiative. The first one is reflexivity, and that's about understanding ourselves in our context, thinking critically about it, and acting on that critical thinking. End to end in the evaluation process. The second one, it's about credibility and what we do to increase other people's trust in in the quality of our causal analysis in the course of an evaluation. So let's go into reflexivity. So what this is about is about informing the choices that we make. And an evaluator makes 1,000 choices a commissioner of evaluation makes 1,000 choices from the moment a terms of reference or a scope is defined till we decide how to support uptake of an evaluation. And so how do we think about informing those choices, considering positionality, our perspectives, our institutional roles, our methods? And so I wanted to take you to the kitchen of an evaluation that I did with Tom Aston last year. It was an ex-post evaluation of community engagement in the education sector. And our working assumption was that connecting new projects to old interventions, whether projects or interventions that the government had been made or others had made in the system, contributed to results over time. But the interesting thing, so we agreed on this, but Tom and I had different entry points into this evaluation. Tom had been evaluating work in the schools, in the front line. So he was particularly interested in connecting all the new projects in terms of like what activities and tools and relationships were happening in the front line. I was coming at the issue having worked with the donors. And so I was really curious about the role of the donors in structuring the support, the role of the government donor civil society policy dialogue, right? So we had different assumptions about not only what was going on and where to look at, but also about what were the audiences and the use cases of this evaluation, who this evaluation was going to inform, right? And this produced a little bit of a productive tension, I would say, because we had to first come to terms with why we were looking at different things, why we were valuing different types of evidence differently, right? Why we would look at documents or interviews in a different light, and even why we understood what process tracing, which was one of the methods we use, a little bit different from each other, right? And how to make something out of these different perspectives. So after much thought, what we decided to do was that we were going to be open about this tension that we had, and how we decided to inform each other's perspective from the other's lens to be able to produce an evaluation that was greater than what either Tom or I would be able to pull off together. And so we put together a chapter in the evaluation devoted to this, to increase the credibility of our causal analysis and where we were each one coming from and where we decided to land together. The last point I want to make about this evaluation is that it was an ex post evaluation with imperfect data, right? We were assessing a project that had finished like 5 years before we came in because we were interested in looking at sustainability. So reflexivity enabled us to have a more rigorous and credible causal assessment, even in those conditions of imperfect evaluation. So credibility, and I want to talk about credibility as a practice now. And you see these two are connected, right? Reflexivity in this framework informs credibility to some extent, or can inform credibility. So how do we ensure trust in the eyes of others? So there's a list there of the general ways in which the causal pathways initiative suggests one might do that. But I'm a big believer in examples. So I'm going to give you a couple of examples of doing this in practice. So I was doing a few years ago a midterm evaluation of a World Bank grant to civil society organization. But a key audience of this midterm evaluation was stakeholders in the Ministry of Education of a country. So I went to talk with, to interview staff of the ministry to get an understanding about what would be most useful and credible to them in this midterm review. And so what surfaced in that conversation was the following. This official was explaining to me that he had generally invested in short-term training because evidence told that short-term training of school staff was a cost-effective intervention, right? Good cost-benefit analysis, value for money, however you want to call it. But he had a problem, and the problem is that staff rotated yearly in the schools. So what looked from a short-term perspective as very credible and rigorous evidence of what good value for money wasn't really paying off to him because he had to invest in the same thing every single year. So he wasn't getting payoff over time. This nugget of insight brought to light something for me really critical, which is that his values and priorities as a stakeholder for this evaluation that I was doing suggested that we didn't need to show that it might not be as important to look at short-term results, but really try to understand how this intervention might help lever that investment that he was making in the short term, or like make it stick in the school over time, right? So that's can be for certain approaches to very rigorous evaluation less than ideal. And yet, from the perspective of this key audience, it was not. We needed to look at the midterm to produce something that was credible and useful. Another example. So a philanthropy portfolio evaluation, a final evaluation with an M&E system that was not set up to do causal analysis, right? So some steps we took in that case. Did a workshop, as many of you probably do or have participated in, to surface a theory of change and prove it. We identified the different people inside and outside the room have different assumptions about how these interventions were going to work out. This portfolio was implemented in different states, different geographies, and to tackle a range of problems in a broader policy umbrella. So we tried, it was important to understand how different contexts modified causal mechanisms rather than average all interventions out, because they were not trying to do the same thing in the same conditions. We used a combination of methods, elements of process tracing, contribution analysis, different types of M&E data, and oral history, which we use to learn ourselves and iterate. But what I want to underscore is that it's the science and the art of causal pathways evaluation. It's not about having the laundry list of methods, but how one combines it for credible, feasible, critical reasoning and causal inference. So let me dive deeper into this. I mentioned that we use oral histories as part of this evaluation. Why did we use oral histories? Well, we needed to bring out voices of partners implementing this with a minimum burden because of a number of circumstances that we were mindful of, right? This was a final evaluation, and we didn't want to impinge on their time, right? But we also wanted for them to see themselves in a product of this evaluation. At the same time, we knew, or we also knew that some stakeholders that were important audiences in this evaluation needed more than firsthand histories to get insights that were useful for decision making and credible for decision making, right? And so we needed to do more than those first person stories. We needed to interrogate them. We needed to think causally about the answers that we were getting. We needed to put them in a chain of events, triangulate data, think about rival explanations from what firsthand we were hearing from, all in a systematic way. And that was critical for us to be able to produce a credible evaluation that would speak not only to the individual voices, but that led on implementation, but to others that were making decisions about this portfolio up the chain. So those are some ways in which one can build credibility in as a practice. So I'm going fast. I don't know, Drew, sign, but just going on, talking a little bit about values now. And you'll see how many of these things are sort of interrelated. So, oops. Building on the inclusive rigor framework, as Drew mentioned, the Causal Pathway Initiative proposes 3 values to guide causal pathways evaluation: equity, learning and utilization, and complexity. What we want to underscore of these 3 values is that no one size fits all, right? So you may be working in a context where inclusion, representation, power sharing, attending how interventions affect different populations in different ways may be very important. As in the case of the portfolio I mentioned, oral histories were very helpful to bring this value to light in that context. But you might be working in a context whether some of these values are critical and others might be even more important, or not. And so what's important is for you to understand what are the values that matter in your context for the stakeholders you are working with, for different users and use cases of this evaluation. But as we are in a causal pathways training, we're going to use these ones as examples of how to work in values into an evaluation. And we thought we'd start with complexity in causal pathways evaluations. So, as you mentioned at the top of the hour, often evaluators assume a simple link between intervention and results, right? And a lot of our criteria emphasize this. Did the intervention go according to plan? Or in another way, if we put a white circle with a black border into the process, do we see white circles with black borders out of the process? And what happens in the process often remains inside this black box. But we also see an increasing trend in evaluation, which is at the bottom of this figure in the slide, which assumes that there's so much uncertainty in the world, especially in complex interventions, that we know that a white circle goes into the intervention, but we shouldn't even sometimes try or hope to connect it to the purple star that we see at the end or the orange square that we see at the end, right? Causal pathways sit somewhere in the middle. That's how I like thinking about this, right? Because we think that there are many paths to Rome. There's not a single way to get to results. There are expected and unexpected outcomes, intended and unintended outcomes. But we do think that it is possible and worth it to systematically unpack that interaction between process and context that happens in the middle. So whether it's the form, the function, the spirit, the thrust, or other ways, we consider what are the threads of continuity, right? So if our intervention, it's largely a white circle, but we know that it goes through a process where we get green and blue and purple inputs, then what we expect to find on the other end is some sort of combination of that. Maybe it's a circle with colors, or maybe it's white but looks like a star. We don't know. And that's what causal pathway evaluation deals with complexity. If you were in the first session of the trainings last week, for example, you probably heard Kimberlyn and Heather repeat oftentimes, we use structured and emergent analysis. That is another way of understanding this middle road, right? It's neither extreme. And so how we embrace complexity in an evaluation is our choice. We make a lot of choices about where we stand in that graph, but also what do we do about and how do we go about walking that middle route. So it's a choice. We generally don't take one voice or one source at face value. We analyze it critically and systematically. And we'll go today through some examples about that. And I'll pass it on to Drew for more of that.
Thanks, Flor. So I'm just going to run through a quick mini case study of what it's looked like in practice to surface values within a causal pathways evaluation. And then in part two of the training, we'll talk a little bit more about how we've operationalized those values to help assess the quality and rigor of the evaluation. This is an evaluation of a virtual and hybrid school model within the US context. And I'll just give you a brief background to help situate the case. On the next slide, we just quickly present for those of you joining from the United States, post-COVID, and I'm sure in a lot of countries around the world, there were a lot of conversation as our young people pivoted to virtual education or hybrid education as opposed to in-person instruction. There's a big national narrative here in the U.S. that post-COVID virtual and hybrid learning doesn't work, that there's been a lot of studies documenting learning loss and literacy and math among young people when we pivoted to virtual school just after COVID. But there's an emerging practice of education researchers and practitioners who are trying to change that narrative, that it's not that virtual hybrid learning doesn't work. is that some approaches work differently for different types of students and different types of context. So with that, the Walton Family Foundation, in collaboration with a national NGO that focuses on education called the Learning Accelerator, had identified 4 school systems in the US that have some promising evidence of achieving learning outcomes through virtual learning. So we've been working with these 4 school systems for about a year now to understand how and why these models are working and differently for different types of students and under what condition. And the intent of the evaluation is to generate some rigorous evidence to inform improvements to school leaders on how they can improve their virtual and hybrid models to accelerate learning, and also to generate evidence that other school leaders and other sites can use as well. So, how did we start to define what we value within this evaluation? Well, we went through a simple process, and let's go to the next slide, Flora, and I'll just share that quickly. These don't have to be a heavy lift for anybody. These are things that you can build into an evaluation, even if you're just a single evaluator or smaller teams. We worked through a 3-step process to surface our values for this causal pathways evaluation. So the first is a reflection. We asked ourselves to think about a specific experience where high quality evidence was used to understand how a program works, and then reflect a little bit on what made that such a positive experience and what values mattered in that being a positive experience. This was an individual reflection that all 3 of us on our evaluation team did separately, quiet, 5 minutes or so, really just kind of gathering our thoughts. And then we shared our individual experiences with each other. So each evaluation team member developed their own short narrative that's talked a little bit about our experiences and helped us then to surface our individual values. And then we worked through a group prioritization session where we were facilitated by another colleague to help to cluster similar values and then to work through and collaboratively prioritize what our quote unquote top values were for this evaluation. And on the next slide, it just shows you an example of what the values identified were within this evaluation. So we identified 4 things that we valued within this evaluation. The first was collaboration with program users. On the left hand of the slide, I have what those values are. And then on the right hand is just some of the individual perspectives that all of our evaluation team members brought to the conversation. So collaboration with program users and participation, engaging users in the process. If we wanted this evaluation to be used by the 4 site leaders and to be used by other leaders, then we had to really prioritize their collaboration in the overall evaluation. So that was one value that surfaced. A second was critical reflection across multiple sources of evidence. We know that testing is just one way to understand how learning changes, but there are other ways as well. So we wanted to build in critical reflection and triangulation through multiple different sources of data and different ways of knowing. So an evaluation that had one single source of evidence wouldn't be considered a rigorous evaluation from our perspective. It had to bring in critical reflection across multiple sources of evidence. The third was elevating lived experiences and multiple voices. Oftentimes, people talk to school leaders or sometimes teachers to get a sense of what's working and spend less time working with students. So a rigorous evaluation of this program for us needed to include lived experiences and multiple voices, not just school leaders and teachers, but parents and students themselves, how they connect the program's understanding and experience, ensuring that multiple voices and perspectives were represented, and participant experiences, and particularly their lived experience, were valued as credible sources of evidence as well. And the last was the usefulness for school improvement, that for this valuation to be rigorous, it needed to be generate actionable findings that could support adaptation and improvement, had to be useful, it had to be actionable. If it didn't serve on that, we wouldn't consider this a rigorous evaluation. So that's just an example of 4 values that surfaced from a relatively easy, not long, rigorous, overly complex process that our evaluation team went through to get here. Um, and now we want to pass that to you to start to explore a little bit of value surfacing with you all as well. As we've been saying, is this first part of the training, when we're designing an evaluation, we have to start with our values. Our every evaluation is grounded in values, whether we're explicit about what those values are or implicit about it. The choices we make, as Flora was saying, the questions we ask, the methods we use are underpinned by our values as evaluators. So we want you to think about an evaluation that you've worked on, currently working on, or were part of either as the commissioner or as the evaluator or as the evaluand, somebody that was being part of that evaluation, and think about how that evaluation rolled out. Now, start thinking about what values might have happened within that evaluation. And if we started to center that evaluation on a value around honoring complexity, something that Floor was just talking about and how that showed up in lots of different ways. If honoring complexity, because of the dynamic and complex nature of a systems change effort, is something that we valued, what might have looked different from your evaluation? Would you have asked different questions? Would you have talked to different people? Would you have used different methods? Would you have made sense or triangulated your findings in different ways? If you were really centering complexity as a value, how might that evaluation have looked different? So similar to my experience that I just shared from our evaluation of the virtual and hybrid learning models, just going to ask you to individually reflect on that question just for a minute or so, which will feel like an eternity when we're all just on a Zoom with nobody talking and everything quiet. But no, take a note, write down something, but just center that evaluation for yourself, that experience. Really reflect on it for a minute and think about what might look different if you centered complexity and honored complexity as part of that evaluation. Once we've reflected for a minute, we're going to create some breakout rooms. You'll be able to self-select into that breakout room. We're hoping to get 5 to 6 participants per room to facilitate a little bit of discussion. And you'll have 10 or 15 minutes or so in to start to share those thoughts with the other people and explore what that looked like for you. And then we'll bring you back in to talk about this a little bit more and make sure to think about as you're starting to share experiences how that might show up at the different phases of evaluation if you were honoring complexity. Questions you'd ask, methods you used. So, I think we should give about 15 minutes for the breakout so people have ample time. And we will open up rooms for you. And feel free to just self-select into the room that you'd like to go to. If you're not feeling the breakout room vibe today, that's also totally cool. You can feel free to just hang out in this main room for folks who are looking to get into a little bit more of a participatory conversation. But you should see a little button at the bottom of your screen that says breakout rooms with 4 stacked boxes. Click on that, and there are a number of rooms available. So just feel free to pop into a room, 1 through 12, and other people will start to join rooms as well. And we'll see you back here at the top of the hour. Great, welcome back. Yeah, no, just wanted to take a quick minute to hear about the breakout session, any aha moments that were shared, anything that you want to share with the wider group about something that was discussed. Who is brave enough to come off mute and share a reflection? All right, let's go with Rachel and then Joy. Hi,
Hi,
Rachel.
everyone. Hi. We had a great conversation in our group, and one of the topics we talked about was what constrains us asking about complexity? What are some of the things that kind of hold us back? And so we talked about time or money or not always being the ones to be kind of in the field doing the data collection in the local language and how to
Mm,
communicate. around like a complexity lens or a values-driven lens to people who are actually collecting the data. And so it was a great conversation just thinking about what are some of the barriers to it, to doing an evaluation in this lens.
That makes a lot of sense. And I think even in exploring that, what starts to surface is what you value around that as well. So I love how you kind of tapped into just thinking about local languages as something that you value and making sure that people are able to share experiences in their own voice and how that would show up differently. So that sounds great. I jealous I wasn't in that room. I would have liked that. Joy, is there anything that you want to share as well? I saw that you had your hand up.
Yeah, no, I think I'm just going to share an insight that I had, but we had two people who were able to take a turn, so we didn't get at the complexity of our group.
All good.
But I was really struck because one person in our group had really underscored what I felt like was at the core of my experience that I had talked about, which is that like the practitioner, the people who are the partners for the evaluator, in this case a program director type person, like the complexity of the program and the complexity from a practitioner's perspective is abundantly clear. And I think I, as an evaluator, have always kind of been tuned in, I guess, just because that's how I started, was focused on practitioners. Whereas evaluators were sort of, taught to kind of be not being as engaged or not be encumbered by that complexity. Um, and so it is, I think the point that jumped out for me is that if you are really tuned in to practice and really kind of empathically and just informing yourself how that is through the process with complexity, that you're you have to do that by engaging with the practitioner's perspective. And so it can be overwhelming because it's all new and it's complexity that you're never going to understand even in the course of an evaluation. But just getting a sense that and assuming that there's complexity, the group member said, it just is never reflected in the evaluation in any way. All of this complexity that's inherent to the work. And so I felt like that just hit that completely on the head for me, because it was what I have experienced in wanting to be very close to understanding what it's like from the program side. And then we have to figure out how to deal with that as evaluators. But I think the cost of not doing that is very high because it simplifies results that are very complex, or processes of change that are very complex.
Yeah, thanks for that, Joy. I think you said it beautifully. And what a great example of sort of merging these two aspects that we've been talking about around centering complexity and what that looks like at every stage of the evaluation, and honoring complexity and what that means for you as an evaluator, both your perspective and your practices. All too often as evaluators, we think that, our job is to determine value, that it's our job as an evaluator to judge the merit, significance, and worth of any given intervention. But if we're actually honoring what complexity means, it's that different people have different perspectives on what the system is, what the boundaries are, what relationships look like. And our role as evaluator starts to shift from determining value to lifting up these multiple different perspectives and really starting to help people understand, reflect, and develop value in a totally different way. So it changes our perspective, it changes our practices when we start to surface and really start to honor that. That was a great example. Thank you, Joy. We could probably spend the rest of this time feeding back around, but there's a lot more to cover. So we want to move to part two of the training now. So we spent the first part talking a little bit about values, how we surface values and what that means, and looking deeply into some perspectives and practices of evaluators. Now we want to pivot and talk a little bit more about how we operationalize these within an evaluation. And we're going to talk about how we operationalize these at two levels. Um, Operationalizing evaluator practices through inclusivity and participation, and how that can strengthen rigor, and then how we can operationalize our values to strengthen rigor and judge quality through the use of evaluative rubrics. So I'll pass it to Flora to start us off.
Thanks, Drew. Really interesting reflections. So excited to see what comes next out of this conversation. So let's start with how to increase rigor operationalizing values through inclusion. The Causal Pathways Initiative advocates for being more intentional about defining rigor as increasing inclusivity into who gets to ask questions, who shapes analysis, interpretation of those of conclusions, and who uses results, right? And part of that, as Drew mentioned earlier, is to think about participation and inclusion in all aspects of a causal pathways evaluation. There's material in the website, which we won't go into detail today, of the initiative about an example, the Clarissa case, that is a robust example that you can get a deeper dive and how, in that particular example, in that context, the team introduced inclusion and participation in every stage of the process. But we want to underscore a point that was made in the first training, is that sometimes it's not possible to do that all at once or to increase participation and inclusion in every step. But what we do think it's really important is to think strategically about what is possible or feasible and relevant in each particular context if you can't do it all. There might be entry points to increase participation and inclusion in select points. And so encourage you to think that way as well. Let the perfect not be enemy of the good, right? And so as evaluators or evaluation people who commission evaluation, we might be able to do so. Now, of course, as many of you know, there are many ways in which one can increase participation, and this is not a training on participatory and inclusive methods. But we wanted to use one step of this to try to highlight some of the ways in which causal pathways evaluation may bring a little bit of a different lens to other ways of doing participatory evaluation or more inclusive evaluation. So we thought we talk about sense making in causal pathways evaluation, because sense making is something that it's increasingly in vogue. We bring stakeholders to try to make sense of, for example, what are our assumptions or findings at different points of the evaluation, right? And so I wanted, again, to share an example to illustrate what a causal pathways evaluation might do in this case. And I'm going to talk about a philanthropic portfolio. This is a real-time evaluation of a portfolio that involves a range of strategies and tactics and actors implementing this portfolio, right? And so we started with bringing key implementing partners to produce, in a participatory way, a theory of change. So they came together, they shared assumptions, beautiful, called 3 pathways of the evaluation context, lovely. So we use this to guide the initial baselining and data collection. When we got by the midpoint of this evaluation, we had identified that implementers' theory of change had an important set of gaps in the assumptions that it mapped. Basically, the implementers had overlooked a concurrent strategy that was being funded by the donor, by the same donor, as part of the same portfolio, and that some people assume was meant to interact and produce positive synergies. But it wasn't in the map that the implementers had set out for themselves. So as evaluators, we had to make a choice there, like midpoint sense making, right? How do we bring this blind spot into the conversation, right? How do we bring the voices that were not part of the initial sense making to the sense making? How do we address the power dynamics, right? Given that this is a subset of the donor team that has assumptions and rather than the implementing team. And how do we bring them together? And how do we make them think critically about, are these strategies really meant to interact, or are they meant to go in parallel? Are they meant to have positive synergies, neutral, or negative synergies? And how do we surface these different views? And so with a causal mindset, I think we understand that we are not neutral. We are there not just to listen what comes in, but also to ask questions and ask probing questions, to bring alternative explanations to the table, right? And engage this different perspective to strengthen and challenge the hypothesis that may come in a sense-making exercise. So we did this exercise and we iterated the theory of change, and we use that revised theory of change to help our assessment towards the final evaluation. And so here's where I want to say, it's in a sense, it is a harder lift, if one would, because it requires us owning our role in what kinds of triggers we bring to the conversation in a sense making that other participatory approaches might not, but that we think will help us justify our conclusions and our analysis in ways that are more rigorous and stronger, even if they sometimes challenge the normative assumptions that subsets of stakeholders might have. And that's one way in what might bring our lens. So as Drew was mentioning, the other way that we thought to highlight, these are not the only two ways, but two ways we thought we could strengthen rigor and causal pathways evaluations is by using rubrics. Rubrics are not new. You might have found them in school when the teacher said you get 100 points if you do A, B, C, D, and you get 80 if you do this other amount of things. Really, what they are is a qualitative scale that has very clear criteria about what levels of performance we care about, and that describes very clearly and transparently what does it take to reach each level. And when we do that in an evaluation, we're making explicit what our evaluative judgment is based off. And so for us, that's why a rubric can be useful. Now, the trick is what goes into a rubric and what we use the rubric for, right? A rubric can be used for many things. So these are some of them, right? For example, at the start of the training, rubric Drew mentioned that there's some people that rate higher certain types of experimental evidence than non-experimental evidence. So, and many of them do it based on a rubric that creates this idea of a gold standard. So that's one way in which one can use a rubric. We might be able to use a rubric to make specific judgments about a specific evaluation content. So we might use a rubric for a critical indicator that we care about. How far, how did we perform on that indicator? But the two that we want to underscore today is that rubrics can help us make decisions about the strength of our causal claim, like how strong is the causal chain that we're talking about. But also rubric help us not only operationalize our values, but make them more transparent, because we're being upfront about them before we make that judgment at the end. And so again, I'm gonna walk you very quickly through an example where we use a rubric for a number of these functions. I was working with the Global Partnership for Social Accountability, which is a global program of the World Bank that operates in many different contexts, and talking with stakeholders inside the program and outside at the World Bank, but also in implementing partners. We identified that scale up for sustainability was probably the most important and most challenging assessment that we had to make. Everyone was frustrated by the way it was being assessed and by the consequences that those assessments may have on both at project level, but also at field level, right? This program cared about setting up sort of like sending messages to the field. And so we decided that it was worth investing and looking at this specific assessment with a causal pathways mindset. What I'm going to say is everything we did over a course of years, it wasn't defined as a plan to do this, but we built as we could, right? Within the context with limited budgets and overstretched partners, right? So we had consultations and dialogues to try to surface what scale up looked like in practice, not only from the implementer standpoint, but also from the standpoint of the World Bank teams that were trying to influence through other channels, scale up and sustainability. We added in debriefing sessions, in stop and learn, pause and learn events, we added indicators as we could to new projects that would start tracking this, and in project evaluations as TORs were being drafted to learn more. Then at what point we were able to secure some funding to do some theory building research to try to map different pathways and triangulate them with that information that was surfacing. And we eventually built buy-in and knowledge to iterate the portfolio theory of change, the donor's guidance, and introducing the log frame and indicator that better reflected what we were learning. And to capture that, we developed this rubric, which I'm going to talk about, which we ended up validating by retrofitting data from existing evaluations and reports and so on, but also looking into new evaluations and reports to validate and refine our understanding. So this is the rubric we came up with. It plays three functions of those that I discussed before, right? So first, if you look at each level of this rubric, it maps the causal pathway that we ended up assuming would go from a project implemented in a school or a health facility to lessons that might inform broader uptake. So first it starts with there's no evidence of any insights from this process being used by anyone else. Then we go into something like, well, we assume that what will happen next is that priority stakeholders somehow would express some interest. Then there might be some conversations, then there might be some actual action to adapt what was being learned from this project in this school to the broader policy dialogue. So we map those steps and we try to assess where projects were exposed, how far did it go down the chain, but also in real time, are they moving in the right direction? And that helped us understand whether this chain made sense or not. Maybe we got the chain wrong, right? So that's the first function. Second function, it operationalizes our values. So I mentioned this was implemented in a World Bank portfolio. And as much as the team in the GPSA or a particular project manager or in the donor or in the implementing agency might have been interested in complexity and adaptation and so on, we know that this also informs stakeholders that are interested in results-based management. So for us, it was very important not to create a benchmark, a score 5, that ended up creating an aspiration trap and might be creating unintended consequences for the teams implementing or the communities that were being part of this participatory processes. So if you look at number 5 here, we were very explicit to say the highest achievement in a 3 to 5 year, $500,000 project in this context is not to expect wholesale uptake of what's going on at school level across the country. That's absolutely unrealistic. Ministries will come in and will take bits and pieces of this. Other directors may take bits and pieces and adapt them, but we cannot expect them 100% uptake. The stretch, and it's hard to attain, but it's also more realistic, it's to expect some adaptation. And so that was the top of our rubric. We didn't impose an external ideal or a normative ideal, but we did try to stretch. And that was our values, making that choice, right? Shared along with consulting with a range of stakeholders about what would be useful for them. So the rubric legitimized that in a context where a lot of experts and a lot of advocates were saying, no, 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 we should shoot for the moon, right? So that was a choice. The third one is using this to appraise the strength of evidence and the strength of our claims. If you look, score 1 requires no evidence. Scores 2 to 4 require some evidence. But what's the key difference between score 4 and 5? Is that score 5 asks at least 2 pieces of triangulated evidence. So we have greater certainty that the claim that we're making has, backup from more than one standpoint type of evidence source. And so you see, in one rubric, we infuse causal pathway thinking to try to make our case stronger and more rigorous and more credible with audiences that had very different perspectives about what should be happening, but also what is credible and rigorous. And I'll pass it back to Drew to share more. Oh, sorry. First, let's go, Carolina. Carolina is going to put up a new poll, and this new poll is going to ask you if about your experience with rubrics. Are rubrics completely new to you? Have you used rubrics a bit in your work, but not in causal pathways evaluation? Or have you used rubrics in the ways that I talked about before, whether it's to assess strength of evidence or causal pathways strength or embed your values? So let's see what comes up. Okay, so you've used it a bit, most of you, 64%, but not within causal pathways evaluations. And some of you, about 28% for you, rubrics are new. Interesting. So we'll hear more about rubrics now from Drew.
For those of you where rubrics are new, we gift this to you from this training. I love a good rubric, and hoping that as you start to explore them as well, you'll see the same. So, as Flora had mentioned earlier when she was talking about the different uses of a rubric, we said that we were going to focus on 2 ways to use a rubric as part of this training in the context of causal pathways evaluation. Using a rubric to aid us in causal claims and the strength of a causal claim, and using it to help us operationalize our values. So when we start thinking about what does the strength of a causal claim look like, there are lots of different dimensions that a rubric could cover to help us think about the strength of a causal claim. So in this paper here from Foundation Review called Raising the Bar, Marina, Tom, Mika, and Tom start to surface a number of different dimensions of what the strength of a causal claim looks like in more case-based research. So 5 of the dimensions that they surfaced are transparency, triangulation, plausibility, uniqueness, and representativeness. Transparency is looking at whether the evaluation clearly documents how decisions were made, how the data were collected, and the conclusion reached, and supports credible and accountable causal claims. Triangulation is more about ensuring that we're not relying on just one source of evidence, as Flora was talking about in her rubric, especially important for making robust causal claims in complex systems where different people might have different understandings of how change happens. Plausibility helps us judge whether the evidence whether the evidence provides a convincing causal claim or a causal story consistent with what we know and what we're hearing from others. Uniqueness is really about helping us to get to an explanatory function. Are we testing assumptions in a rigorous way, or are we just reinforcing our preconceived notions? And then representativeness really is a way to think about equity. Are we hearing from the full range of people affected, especially those whose perspectives are often excluded within an evaluation? So you can think about these different dimensions, and then each of those dimensions can be converted into a rubric, the way that Flora was mentioning. So on the next slide, we just provide one example of what a value-grounded rubric could look like in practice. And this is just a rubric designed around one of those dimensions I just shared, plausibility. So this comes from the Clarissa case study that Carolina dropped into the chat. So you'll see a lot more about this if you want to take a look at that resource. But ultimately, it unpacks this concept of plausibility and orders it along a 5-point scale. So some of the things to note here is that we're not using plausibility as a binary, that it's something is plausible or not plausible, but it builds off the degree of that. So we're not just saying, is the evidence good enough, but does it start to build a credible, compelling, and coherent story as we start to move through the phases of the rubric? And it's not just a score, but it's more of a qualitative judgment along this. So each of these has a more narrative or qualitative judgment that you can use for judging a causal claim, which opens it up for a little bit more room for maneuver or discussion, particularly in different people might have different notions around these things. So in using it in this way, we're not saying either something is plausible or not plausible, but we're starting to open up the debate a little bit about where something lands within this 5-point scale. And we could develop rubrics like this for all of those different dimensions. Now, just to make it clear that there's different ways to come up with these categories. So if we were to just define these categories ourselves as the evaluator, that's one way to approach it. But we also might think about bringing in multiple stakeholders and through that conversation, collectively judging. If we want to judge the strength of a causal claim, what would this look like across these 5? And the more people that we can bring into that process, the more buy-in into the credibility and the strength of that causal claim will be. Another way we can think about this is that if you design these rubrics early on in an evaluation, well, they're not just about passing judgment at the end, but there's something that can actually guide improvement as we go. So you could assess how you're doing in building a plausible causal claim early on or midway through an evaluation, and then use this as an improvement tool to think about, okay, what else could I do to move from a 3 to a 4 or move to a 4 to a 5? So we're using it in a continuous improvement frame as well. So there's a lot of different ways that we could use this rubric. I'm just going to give you an example now about how we used a similar process, going back to that same case study about the virtual and hybrid learning. And in this, I want to talk a little bit about the strength of the causal claim, but also how we used it to operationalize our values. So I just went through on the next slide just to kind of highlight that I just talked a little bit more in detail around these 5 dimensions of a strength of a causal claim that were drawn from the literature, particularly sourced within this article, Raising the Bar, but other places as well have put these together. And those are just a few of the dimensions. In fact, there's multiple other dimensions we could think about as well. And on the next slide, I started to just add on and layer on some other dimensions that you might consider in the strength of a causal claim. So maybe you're thinking about transferability of the findings from one case to another case, or ethics and how those data were gathered, the responsiveness to different types of stakeholders, the independence or uniqueness of the evidence. Oh, I have uniqueness twice. The independence of the evidence, and then utilization as well. So there are multiple different dimensions that we might use to judge the quality of a causal claim. We might not be in a facility where we can do all of those and do them all well on a 5-point scale. because of a resource setting or constraints, or because some of these are just more or less important. So one way to help us situate which of these we want to surface more than others is our values. So on the next slide, I'm just going to remind you quickly on this evaluation that I was talking about earlier about the 4 values that we generated and surfaced as an evaluation team: collaboration with program users, critical reflection across multiple sources of evidence, lived experience and multiple voices, and the usefulness for school model improvement. So considering those different dimensions of how we could think about a credible, quality, rigorous causal claim in these values, we then went through a facilitated participatory exercise as an evaluation team, or just a screenshot of what this looks like on the next slide. But we ultimately came up with a little bit of a prioritization exercise where you can see on this spider diagram target kind of thing, we have those different dimensions of what a causal strength of a causal claim could look like, how we might judge or assess the strength of a causal claim around the outer rim. And then the different layers are how important we feel that each of those are. The different colors of the blue, the purple, and the red were different evaluation team members. So we looked at the different dimensions, we sat with them, we reflected on our values, and then we went through an individual exercise to place if we were embodying these 4 values within our evaluation, which of these different dimensions of a causal claim would we prioritize? And everybody put their votes where they would. In the quadrant or the part of the spider diagram for that particular dimension, and then closer to the center is a stronger priority, farther out is a lesser priority. And then we use that exercise to align as a team on 4 key dimensions that we would use to judge the strength of a causal claim. So on the next slide here, I just share the 4 that we landed on: triangulation, plausibility, transferability, responsiveness, and representativeness. Those were the 4 dimensions that we're going to use to anchor our judgment on the quality of our causal claims within this evaluation. They have a description here, and because we're doing this at midway through the evaluation, we also started to think about some approaches that we can use to support those criteria as we go, in ways that we might be able to work those into the second part of the evaluation. And ultimately, this is where we're at now. The next step of the process is then turning each of these 4 dimensions into a quality rubric that we're going to generate with our partners, and with the funder as well, about what those would look like on a 5-point scale. And in the Clarissa case study, there are a number of different rubrics that are a good starting point in thinking about how you might want to adapt, so you're not starting from scratch as well. So I just kind of screenshot on the next slide another example of what one of those rubrics looks like. So for instance, on triangulation, a 1 is no evidence that corroborates the connection between an intervention and outcome, whilst the highest level 5 is multiple lines of high quality evidence from multiple sources corroborate the connection between an intervention and the outcome. And then we have some stages in between. So this was a good starting point for our team to think about how we're going to develop our own triangulation rubric that's going to make sense for the context of our evaluation, in collaboration with our program users and our funders to develop this. And ultimately, we'll use this to judge the quality of the causal claims that we make at the end of this, and thinking about ways that we could improve that as well. So it allows us to be very transparent about how we're assessing quality and what that looks like. All right, we want to create a little bit more space for you all to connect and discuss before we move to questions. So we're just going to have maybe, let's say, 12 minutes on the clock. Go back into breakout rooms as you wish, and think about a specific evaluation you know well, one that you've been part of. What values were or were not made explicit in that particular evaluation? And think about maybe one concrete thing you could have done to increase the quality and the rigor of the study, drawing on what we learned and what we talked about today, and share your example with a small group. I am also very happy if you'd like to jump into a session and talk about what we did and what you do differently and how we can improve. I'm a continuous improvement guy for anybody that knows me. So also very keen to hear thoughts on what we could have done differently as well, if that's a more useful topic. Um, Other way, we'll just take about 12 minutes or so, and then we'll come back and have a quick wrap up and some questions. Flor, what do you think about maybe taking down the screen share just for the Q&A so we can see each other, and then we can put it back up for those final slides if we want to. So 39 of you have made it to this phase of the training, which means you probably have some, and I guess me, Carolina, and Florencia are part of those, so 36. Means you might have some questions that you wanted to get to towards the end. So maybe let's open it up to you all, to hear what you're thinking about, where you're sitting with right now. Any questions you have for Florencia or I? Joe, I think that might be your settings, but you probably can't hear me saying that because you can't hear. Let me just we'll both post in the chat to let her know. All right. Any questions that anybody wants to raise here? How relevant is this to your work? Can you see taking forward any of this? Kate, you're nodding vigorously. Do you want to share anything?
Yeah, just briefly, because I noticed that
Yeah.
Cara got her hand up as well. We were just talking in our chat actually about the discomfort that sometimes comes with sharing values.
Hmm.
In I Hadas was talking about how sometimes you can share them and actually it's a bit of an awkward moment where there's
Yeah.
where do we go from here? And we were just discussing at the end actually with Joy as well about how do we how do we continue to sort of live those values throughout the evaluation process? And had a
Hmm.
mentioned that like keeping checking in and saying, remember these are values we talked about at the beginning. To what extent are we, still engaging with those or not, and why? And I thought that that was really interesting because actually, it's just for me it's been an interesting way to look at things, and I work with values all the time in the other work that I do when I'm not
Yeah,
doing evaluation. So it's really crazy that I've never thought I'm going to bring them into this as well.
for sure.
But sometimes you need that moment. So
No,
just
yeah,
about it
absolutely.
as a mechanism to just get people talking and thinking about, well, where do we go from here and how do we make decisions? I don't know if that was
Absolutely.
useful, but like that's been my process, I guess, and some really great conversations with both breakout rooms I've been in today. So thanks.
For sure. Thanks for that, Kate. Corey, you've got your hand up. Anything you'd like to share or question you have?
Yeah, I also find the values very interesting. I was thinking a lot throughout this session and the last one is there's a big emphasis on co-creation and bringing people into the room, but there hasn't been a lot of discussion, and maybe it's still to come, about power dynamics and bringing a lot of people into the room. I work a lot with multi-stakeholders, so funders and ministries of education. Florencia knows exactly what I'm talking about. And the power dynamics are really challenging to bring people into the room and who makes the final decision and the hierarchies and all of that. So at some point, it would be great if we could hear your thoughts on that, either in this session or in the following.
Yeah, I think I'm going to first off note to Carolina that that's a omission from this training, that we need to talk about power in a future iteration of this. So just a learning from us. Thank you for lifting that up, Corey. Um, I think there's probably a difference from my personal experience between, facilitating multi-stakeholder processes and having everybody in a physical space. And I think one of the skills that an evaluator has to hold is understanding what those power dynamics might be. So when does it make sense to have the commissioner and a person that is most impacted by a situation in the same room versus when are you doing that in a um, separate sessions? So bringing in multiple stakeholder voices doesn't have to necessarily be collaboratively. We might surface some values with program implementers and the commissioner separately. And then as the evaluator, thinking about how do we create a process to think through how different people are valuing something from different perspectives. And then what are we going to take forward in the evaluation and helping bring other people into each other's perspectives, and values can be a way to do that. So I think it's a really important notion that inclusion and participation is important, but only if it's safe and it's not going to cause harm, and we need to be aware of that. Flora, you probably have a lot of thoughts on this.
I just want to leave some provocation. So I think Drew talked through his example of students and people in the front line, and one can think on that dimension because we often talk a lot about power dynamics in that sense. And so we put the emphasis there. In my experience, I've also worked a lot on creating evaluations for donors' own learning processes, right? And I think it's really important. I guess in my role as an evaluator, I often try to think also about interrogating those processes within donor agencies, right? When there's space, and furthering learning there to make those decisions accountable as well. And sometimes those decisions that are of interest at that level really are not necessarily the ones that you're going to get a teacher and a parent to engage with. There are different levels of that conversation, right? And it's not necessarily productive for everyone to be in the same room. It's not just a question of doing harm. The uses of this evaluation, the inside knowledge, right, are different. And so accepting that, I find that it's super important, but also increasingly difficult to serve like we want to be everyone. That as thinking politically about, and another theme that Drew and I like a lot, sort of like thinking politically about how our structuring of the consultation sense-making process and questions looks like is super important. And for me, it's core to this process. But, different people manage it differently. There's no, again, and different organizations are different. I think also, you don't, if I'm working with a philanthropy that is a very strong justice and equity lens within, and so those normative assumptions and aspirations are integral to their DNA, I am not necessarily going to navigate power dynamics in the same way as if I'm working with an with a donor that it's more results-based management, full of the politics are there, but they're in a different cover, right? So what I think it's, as evaluators, we also decide how far we push, where we don't push, in how we structure those seemingly technical steps, right?
Yeah. We have just a couple minutes left, so Flora, since you were speaking, I'll give you a minute to kind of read through the chat, and I'll try to touch on a few things that I saw in the chat as well. So let's just say that we follow Drew's advice and we do our little, individual, and this group has this and this. So then we have lots of different values, and we probably have to prioritize those and bring those together. And ultimately, a lot of that does come down to a commissioner decision. And I've had positive and negative experiences when the commissioner values things that are different than people who are most impacted by the problem, even sometimes they're grantees. This shows up a lot in equitable evaluation work where a commissioner says that they want to do equitable evaluation until some of the things that grantees value is the consequences of the commissioner's decisions around what they funded and how they funded and what that means for the wider ecosystem. And then when the light starts to turn to them, things get a little bit more awkward and there's some difficult conversations there. So I don't have a right answer, but I think it's important that we're holding that. And even in the experiences where ultimately the commissioner's values differed from grantees' perspectives, and maybe we weren't able to follow those in the same way that we would like, at least surfacing and making those differences transparent and open, I think is really, really important in bringing our commissioners along on their journey as well into thinking about this work. And we start off evaluations in lots of different ways, and I think there are ways that are kind of more lower lifts to start to bring this in. Typically, when we start an evaluation, we do a document review. We talk to people to kind of onboard as part of a design or inception or discovery phase. Let's add some questions about values into that, or things that you think drive quality or rigor. And we can, start to surface those and then report those back. So you could have an evaluation design document that includes your quality assurance plan that starts to bring up some of those values and some of the rubrics that you've had. And maybe you're not able to participate, rather to facilitate a wider session to generate and surface these values, and then kind of workshop them together. But you can gain information or insights from touch points or other things that you've read from a program team and use those to come up with at least a first pass. Put those in the design document and see what the commissioner says or does or how they react. And that gives you a starting point, or at least opens a conversation about how you might start thinking about quality assuring causal pathways evaluation in a different way. I'm going to have to end it here, unfortunately, but we will start to share some of the recordings and a lot of the different resources and lots of different ways that you can also engage in the Causal Pathways Initiative. Let me just pass it to Flor for any final words before we close.
So just to answer some of the like very quickly, some of the questions that were there, I think for me it's I don't take I take a very politically minded approach to evaluation, understanding constraints and opportunities, and trying to make justified choices transparent, listening into. So as an evaluator, I have the perspective of zooming in and out of the organization, right? From the front line to boards of decision making. I look inside this organization and this portfolio, but I also work with others. And so I think that brings up a perspective, right, to helping inform some decisions. And not every decision is made with everyone, right? At least in the context that I work, that's just realistic, but it needs to be able to we need to be able to justify it. And it needs to be logical and understandable. And then we need to be able to communicate those decisions in a meaningful way to different stakeholders. So my M&E commissioner might read like a 50-pager that has super detailed information on the process and might be interested in that. The board person or the community person will need a completely different way of getting at that information. They're not going to read more than a deck with good wins. And so navigating that with that kind of judgment and also being mindful of when you might risk doing harm. I think like those things are for me quite important kind of rules of thumb, if you would. So that's what I have principles, rules of thumb that help me make those decisions. And I try to make them as transparent as possible to the people I'm working with at different junctures. But you can start small. I think that's the other thing. And as I read someone there, learn by doing. That in most organizations that I worked in, that has been the case. That's what we need to do. And so I encourage you to take the leap of faith, because I think that on the other end, the rewards are quite interesting.
Nice way to end that, Flora. That was beautiful. Thank you. Thank you, everybody, for coming. Really appreciate you spending 2 hours with us today. And yeah, please feel free to reach out to Flora and I or anybody from the Causal Pathways team. Special shout out to Carolina behind the scenes, making everything work as seamless and fluid as possible as well. Take good care, everyone. Have a good rest of your day, and looking forward to engaging with you in other venues in this initiative.